I am going to kind of give an overview of kind of where we're going here, and I'm going to take my stop my video and just leave the mic on. So we're today basically the topic is individual and system or cultural strategies to look at ways to manage stress, or if you will, burnout, or ways to grow and develop and avoid getting down the process of burning out. For those of you that have been to some of our other presentations or have at all kind of paid attention to what's out there, it's hard to avoid the idea of stress and burnout coming up in healthcare. So we're going to talk initially about individual strategies and then system strategies, and through the built within the presentation are not only what it looks like, but some actual kind of plans that you may consider if they resonate to help with you. So let's go to the next slide. This is just an overview across the spectrum of various healthcare professionals, whether it's a nurse or advanced practice provider or physician, a dentist, what have you, looking at individuals that are, this is a snapshot in time in 2023 of who's stressed or distressed, and who's struggling and who's doing okay, and then who's thriving. Again, obviously, this is influenced by emotional tone and cognitive processes at the time of the survey. The idea, though, was to encourage individuals to take a look at just more than how am I doing in the present moment. So you can see there are varying ranges of in the red and yellow across kind of the spectrum. So if you look at physicians, and you put basically, it's about half that are in the either the yellow or the red when you put the two together. So let's go to the next slide. All right, so here we're going to move into the individual strategies and start with kind of Seligman's work. Incidentally, as we go through the presentation, you will see there are some references, some books that we talk about, and some of their strategies, and largely the research that they've done. If you look at within psychiatry is not done well in terms of kind of looking at preventative or positive sorts of things that have been more focused on psychopathology. Seligman started that way. He's a psychologist, and he's in Pennsylvania. He started that way and was really treating individuals that had a lot of kind of significant mental illness. And he changed gears because he felt like he needed to go upstream, which is really what our LifeBridge program is about, is going upstream to prevent things from happening. So some of the well-known individuals that are psychologists within the what are called positive psychology field include Seligman, a guy by the name of Csikszentmihalyi, who just recently passed away. He wrote a book called Flow. Barbara Fredrickson, she's at North Carolina. The Ed Diener and his son, and then a woman by the name of Sonia Lyubomirsky. She's at UCR, University of California at Riverside. These folks have really shaped the field, and we're going to cover some of the things that they've talked about, but I'm going to add to it as well. Before we get into what their strategies are, based largely, not solely, but largely on cognitive and emotional regulation and processes tied to mindset, I want to go back to another thing that we've talked about before, and Lindsay and I have gone through, and it's the importance of, and I can't stress this enough, it's the importance of a few other factors that if they're overlooked, the other variables that we're going to talk about today on the individual level, you'll have limited gains with them. So those other things include various aspects of exercise and movement, which includes aerobic exercise, aerobic efficiency, aerobic capacity, and so on, strength and stability and strength through a range of motions. So in essence, a number of things tied to movement and exercise. has a profound effect on not only confidence, but also on individual growth factors, whether it's insulin-like growth factor, vascular like growth factor, or in the sense of the nervous system, brain-derived neurotropic factor. All of those have varying degrees of effects on physical health and cognitive and emotional health. So exercise, really important, can't be overlooked. Secondly, sleep. Sleep deprivation, even if it's mild amounts or persistent over a period of time, compromise an individual's ability to do some of the things that we're going to talk about today on the individual level. So sleep has a big effect on not only metabolic parameters, but on emotional regulation, on decision making, on, in essence, cognitive horsepower, if you will. So judgment, planning, anticipation, and seeing a bigger picture, treating patients, if you will, and thinking broadly about some of the potential diagnoses if things aren't clear. Sleep has a huge effect on those components, as well as things like immune function and cardiovascular function and so on. So sleep cannot be overlooked as well. The third thing is, and well, I'm just going to make a comment, is the importance of diet and the effects of diet on kind of nervous system function as well. So I don't want to get into that too deeply because we're going to cover some of the other areas, but I don't want to give you the impression that there are not other variables that are really important, including like sleep and diet, what you're putting in your body, and then exercise. So Seligman, after writing and doing a lot of research, including in the area of learned helplessness, and he's written numerous books if you're interested in him, Learned Optimism and so on, or some of them, he came up with this idea of how can we get people to be kind of at the top of feeling and their best, and what are the ingredients that go into that? And he came up with this idea of PERMA. So experiencing and looking for situations that generate positive emotion. You can substitute the word emotion, in my opinion, with energy, because our attention goes where our energy goes. And so if we're in a realm of kind of positive energy, often what we're paying attention to is something that has value or meaning to us. The second is engaging in states where we feel that we really enjoy, they resonate with us, and we're drawing attention to them and seeking more of them. These are the types of, this is Csikszentmihalyi's work of the flow state. These are times in your life where you feel like, wow, where did the time go? I can't believe it went so fast. I want more of this. I hope I get another experience like this. And you just are resonating physiologically as well as within your mindset and your emotional tone. Relationships, and you're going to hear me say this over and over, and the importance of relationships. I will come back to this, but have a profound effect on kind of our well-being and this PERMA concept. Doing things that have meaning to us, value to us, a sense of fulfillment, if you will, and then seeing that what we're doing has made an impact. So how do you sort this out, right? And his research, and it's free, and if you're interested, get on and do a Google search on VIA, value inventory characteristic strengths, and it's assessment, value inventory assessment, to look at what are your core strengths. And these have been studied over and over and over. And I've done this at various points in time, separated by several years. And it's not 100% consistent, but my core kind of strengths tend to be fairly consistent within that process. And that's your sweet spot. That's where things are going kind of the best for you, and so on. And so then he talks about reflection and the idea of drawing attention to what went well and how things may connect with your thinking processes in terms of drawing attention to what went well. Let me give you an analogy here. The old way of thinking about things that he started with is, if I took a test and I got a 90% on the test, is drawing attention to the 10%. Oh, I got 10% wrong, and drawing attention to that negativity and so on. There's nothing wrong with learning from the experience, but what he's saying is that we're not giving 90% of our attention to where we got 90% of things right. And so that's the what well sort of thing. Let's move on. to the next slide. This is another book, The Happiness Advantage. And basically he says, happiness and success are linked, but not completely the way maybe people think about it. Success doesn't always equal happiness, but rather happiness is a tool that you can use to increase your performance and quality of life, and dial in or pay attention to some of the things that are, again, energy producing, or have a valence or a value within your emotional tone. And he goes into 7 principles here to say things that may help you in the work setting or in your life to enhance your kind of performance, whether it's cognitive performance or emotional regulation or physical performance. And he goes into specific strategies. The Tetris effect really is the idea of what can an individual do to pay attention to those aspects of their daily routine that are create emotional kind of happiness or tone, and then staying with that process, following through and making successive approximations or little changes, incremental changes, if you will, to focus on how can I get a little bit better every day. Because as he's pointed out from his research in this, in the book, willpower alone is not enough to affect change. There needs to be some action-oriented kind of strategies that you track and that you're invested in, and then it can kind of grow and develop over time. And you're spending more time on the positive momentum, if you will, as opposed to the kind of negative sorts of things, still knowing that they're there and using the infrastructure around you to promote change. So that social investment is the infrastructure. That's the deep, meaningful relationships that individuals you can kind of turn to, that are there, that you put your message out, that kind of what you want to do, and you're asking them to kind of help you and in a way, but they're invested in you and you're invested in them along the process. Let's go to the next slide, please. So as you think about, this is a video, I'm sorry, before we move into the next kind of topic. So we're going to play the video here, and please listen to this, and he'll summarize kind of some salient points to consider.
We need to reverse the formula for happiness and success. In the past 3 years, I've traveled to 45 different countries, working with schools and companies in the midst of an economic downturn. And what I found is that most companies and schools follow a formula for success, which is this: if I work harder, I'll be more successful. And if I'm more successful, then I'll be happier. That undergirds most of our parenting styles, our managing styles, the way that we motivate our behavior. And the problem is, it's scientifically broken and backwards for 2 reasons. First, every time your brain has a success, you just change the goalpost of what success looked like. You got good grades, now you have to get better grades. You got into a good school, now you have to get a better school. You got a good job, now you have to get a better job. You hit your sales target, we're going to change your sales target. And if happiness is on the opposite side of success, your brain never gets there. What we've done is we've pushed happiness over the cognitive horizon as a society. And that's because we think we have to be successful, then we'll be happier. But the real problem is our brains work in the opposite order. If you can raise somebody's level of positivity in the present, then their brain experiences what we now call a happiness advantage, which is your brain at positive performs significantly better than it does at negative, neutral, or stressed. Your intelligence rises, your creativity rises, your energy levels rise. In fact, what we found is that every single business outcome improves. Your brain at positive is 31% more productive than your brain at negative, neutral, or stressed. You're 37% better at sales. Doctors are 19% faster, more accurate at coming up with the correct diagnosis when positive instead of negative, neutral, or stress, which means we can reverse the formula. If we can find a way of becoming positive in the present, then our brains work even more successfully as we're able to work harder, faster, and more intelligently. What we need to be able to do is to reverse this formula so we can start to see what our brains are actually capable of. Because dopamine, which floods into your system when you're positive, has 2 functions. Not only does it make you happier, it turns on all the learning centers in your brain, allowing you to adapt to the world in a different way. We've found that there are ways that you can train your brain to be able to become more positive. In just a 2-minute span of time, done for 21 days in a row, we can actually rewire your brain, allowing your brain to actually work more optimistically and more successfully. We've done these things in research now in every single company that I've worked with getting them to write down 3 new things that they're grateful for 21 days in a row, 3 new things each day. And at the end of that, their brain starts to retain a pattern of scanning the world not for the negative, but for the positive first. Journaling about one positive experience you've had over the past 24 hours allows your brain to relive it. Exercise teaches your brain that your behavior matters. We find that meditation allows your brain to get over the cultural ADHD that we've been creating by trying to do multiple tasks at once, and allows our brains to focus on the task at hand. And finally, random acts of kindness or conscious acts of kindness. We get people, when they open up their inbox, to write one positive email praising or thanking somebody in their social support network. And by doing these activities and by training your brain, just like we train our bodies, what we found is we can reverse the formula for happiness and success, and in doing so, not only create ripples of positivity, but create a real revolution. Thank you very much.
Life is not all a bowl of cherries, and we know that. And I appreciate how rapid he went through a number of different things. So you can review that if you're interested and read his book. When we look at triggers in our life or adverse experiences and antecedents, what happens is we often have automated kind of thoughts that go along with these judgments, if you will, or beliefs, cognitive beliefs around an event that takes place that generates a feeling and then a behavior. We get caught up in the feeling and behavior and don't go off and upstream to look at not only what was the antecedent, but what were our thoughts around it, and testing the evidence around the thought or the reality of the thought, because it may be inaccurate. The other part that's really important, I think, is that many people have these myths about happiness, right? Such as it's a natural state for human beings, or if you're not happy, you're defective, or to create a better life, we need to get rid of our negative feelings, and so on. We tend to do better when we recognize that happiness is not persistent and pervasive, and that we are going to have kind of struggling times, and accept the fact that, hey, we're having negative kind of emotions or feelings or thoughts, and then try to diffuse them and not connect them with other experiences throughout our day, not tie them to a pervasive state of this is the way everything is, but expand that space to say that's happening there, but there are other components in my life that things can go okay, or I can use distraction or deflection, in other words, after I'm aware of it and reflect. So how do you do that, right? Part of it is looking at our values. What do we value and what's important to us? And deep down inside, what's important to you, right? What sort of things are important that you would like your life to look like? And what kind of person do you want to be? What sort of relationships do you want to have? And then you connect those values to, if you will, committed actions, and then you can start to shape or change experiences. So when you look at Ben Shishar, his original course at Harvard, quite fascinating. It's only 3 or 4 students signed up for it within a couple years, and since then it's been the most popular course at Harvard, partly because I think of his teaching style, partly because of the topic, and partly because I think people are suffering and they were looking at, how do I get more fulfillment out of my life? And he really divided it into the individuals that are nihilistic. They have a negative view of themselves in the future. The hedonistic individuals, that's pleasure in the moment. It's ephemeral or capricious. It goes away fairly quickly. And then many of us that are in medicine are in the rat race. It's I got to do this, this, and this, and there's an intensity amongst everything that's going on, and it creates an edginess or irritability to get to the finish line, so there can be some enjoyment, right? But it often doesn't result in us getting to the finish line. It's almost shaped kind of the way we do things, even if we do get to that process, and we haven't had the opportunity, or given ourselves, the opportunity to experience some of the things along the path or along the way. You heard the old saying, smell the roses. Well, it is important in our talk today, in the sense that you have to be intentional around looking for experiences that have meaning and purpose in your life, and make smelling the roses a built-in routine, a process, because it's not just the absence of negative emotions or pretending like things are better in adversity. Positive thinking doesn't just magically happen, if you will. And And an upbeat outlook on life alone isn't enough for most people. Positive thinking is around smelling the roses and a mindset to say, I'm going to be intentional and deliberate about looking for positive things or things that have meaning to me in my daily routine that are congruent with my values that I want to get more of. So he really looks at kind of the idea of a process and self-recognition, and then trying to move your patterns of behavior in a different direction. Let's go to the next slide. Sonia Lyobermersky's at UCR. Oh, here's another video. I'm sorry. Then we'll go to Sonia. Yeah, go ahead. Go back to the video.
Archetypes, as I present them, are theoretical formulations of types, not of actual people. To varying degrees and in different combinations, we all have characteristics of the rat racer, the hedonist, the nihilist, and the one who is happy. We all sometimes reside in one of the four quadrants. For example, we all sometimes do things that provide us with present benefit but little future benefit, whether eating an unhealthy but tasty meal, watching a favorite sitcom, or playing video games, or hanging out in a fun place without accomplishing anything in particular. In moderation, there is everything right with being a hedonist. All of us at times find ourselves in the rat race quadrant, focusing on future benefit with no concern for the present. For example, we may be putting a lot of tedious work studying for an exam, or struggling to finish a project at work, or refraining from eating an extra dessert because we know how we'll feel in the morning. Once again, it's inevitable that the right thing to do at times is to sacrifice our present experience for an important future outcome. And unfortunately, no person is exempt from experiencing nihilism, whether as a result of a particular disappointment or failure, or because it's just one of those days. We're human beings, not machines, and we naturally experience ups and downs throughout our lives. And then, of course, we all find ourselves in the happiness quadrant, whether it's eating food that we love and is good for us, or spending time with people we care about and strengthening our bonds with them while having fun, or engaging in a fun project at work that will help us advance professionally. So while we're all familiar with the four quadrants and will continue to visit all four for the rest of our lives, one of the paths to a happier, more fulfilled life is to increase the amount of time we spend in the happiness quadrant. Here's what.
So if you look at and that was again out of the Harvard's work and the four quadrants, and now we're going to shift gears into complement what's going on. Sonia Lyobermersky is at the University of California, Riverside. She's devoted her career as a social psychologist, studying processes related to the how of happiness and similar concepts, and looking at how do people experience more joy and contentment and peace and love in their life. And one tenet that goes along with that is making it a part of the process of our life, meaning that a commitment to benefit not only the way we feel, but others around us in the work setting or our communities or what have you. And she really thought of or came up with, after doing her research, that there is a growing body of evidence to say it's not solely just, hey, go do it, but roughly, depending on how you look at it, 10% of it has to do with our circumstances. 50%, she believes, is probably related to the genetic component, and I'm going to come back to that. And then 40% is we have the ability to kind of regulate our own experience through kind of designed, purposeful, deliberate efforts. When I say the 50%, referring to genetics, with the research that's come out in the behavioral health world and the neuroscience world, epigenetics may influence that 50% number. It may not be such a hard or fixed number, but nevertheless, there is a happiness kind of set point that seems to be influenced genetically. But then there's the other aspects that can influence the 40%. So how do we influence the 40%, right? What do we do to have an effect on that? And I'm going to give you some examples. Some may have meaning or resonate with you, others may not. It's looking to cultivate experiences that the feedback from the experience, there's a positive kind of emotion or a positive experience for the individual. So the two that jump out above most others are expressing gratitude, right? And this can be journaling or mechanisms to express gratitude. And then the second is practicing acts of kindness, intentional acts of kindness, if you will. It doesn't mean that other things don't work, such as targeting kind of or cultivating optimism or working towards goals that are important to you, or learning to forgive. Those things are important as well. And it doesn't mean that other things aren't effective. One of the things that she addresses and that I think is important is looking for blockers or barriers to happiness, and how do you manage those? And part of it is around a mindset. You know, what happened? How did I respond? What could I have done differently? What are my growth opportunities here? What good came from this? And then also she said, you know, that it's really important that when we get into rumination or negative states, that often is tied to, I'll give you one example, to social comparison and strategies to get out of the social comparison or that negative kind of rumination and emotional states. So visualizing, here's another strategy, what you need to do action-wise, and then carry out the action. In other words, you're rehearsing in your mind, this is what I want to do, this is what I need to do, and then actually going out and making a step towards what you want to do. Not an all or none phenomena, but a step to where you want to go, and tracking that progress over a period of time. So let me give you two other examples of how you may kind of connect with happiness in your own life that are unrelated to the previous examples I've given. Showing appreciation. So let's say your significant other in your life is maybe the most important person to you, or one of the most important anyway. Looking for ways to show appreciation towards and sharing them with your significant other. Or the Michelangelo effect, if you've not heard of that, that's practicing kind of routinely how you can see the angel in your partner, if you will. And that's a long-standing kind of but you have to kind of train your mind to that, to say, I'm looking for the angel. What are the good things that are happening here, and drawing attention to that. And that's a real relationship builder versus, you know, finding flaws and so on. The final thing that I want to share with kind of her work before we move on is the frequency of small pleasures versus the intensity of infrequent pleasures. Infrequent, intense pleasures don't have the pervasive effect on emotional well-being or happiness, or, if you will, flourishing in this context. So it's important to think about recognizing and acknowledging small pleasures. And there's a number of ways that people can do that. And she elaborates on it some in her work. Another thing to think about, and I said there's one more, I'm going to add one to that, is having goals and tracking your pursuit towards your goals. Often, though, the goals that people have can have a kind of a deep set of meaning for them as well. Now, I want to go back to something that has before we go to the final slide that I'm going to cover. And I say back because it overlaps everything I've talked about so far. There was a longitudinal aging study that's been going on for 80 years, or there is, and it's been going on 80 years, run by the last 40 years by a guy by the name of George Valiant, who wrote the things around the natural history of alcoholism and adaptation to life and so on. Well, within this separate study, the longitudinal aging study, there were two groups, and one lower socioeconomic and one kind of in the moderate to higher socioeconomic. And they looked at all kinds of things in terms of what were the things that had to do with well-being and positive aspects of life that had to do with length of life and aging, and influenced other variables such as cardiovascular health and cancer and so on. And what they found, there was a number of variables that were really important. And I don't have time to cover those, but I have time to cover the two that rose to the top. Number one was having love in your life. It had the biggest effect on everything. Having you know, someone that you can turn to, that you can call at 4 o'clock in the morning, or that's in the house with you, or that's your partner, or whatever, having love in your life. The second thing was not losing it, meaning not losing the love in your life. That's how strong love and the connections were in terms of well-being in relationships. So though that variable, love and not losing or having it in your life, has a profound effect on happiness, resiliency, working through things, success at work, growth at work, parenting, on and on and on. So it's a really important component. Let's go to the final slide that I'm going to cover, and this has to do with kind of the modern workplace tied to burnout, which I mentioned at the beginning that, you know, burnout is being talked about an awful lot. And really the idea here is it's not enough to work harder. In fact, what happens when many individuals get burned out, they work harder and accomplish less. And so it's not working necessarily harder or solely working smarter that has the biggest effect on fixing kind of, you know, burnout or feeling overwhelmed and distressed. And it's into some of the concepts that I've gone through briefly today, and that has to do with beyond the sleep and the diet and the exercise, the deliberate kind of deep actions towards creating the perma from flourishing to a mindfulness kind of awareness of where you're at with your thoughts, and then making time to reflect on those thoughts, if you will, and connecting with individuals in your life that have meaning or can provide love and support to you. It doesn't mean you have to run out and connect. You don't have to be an extrovert. It's those few or many relationships, whatever, that have the ability to provide kind of a comfort and a peace for you. And then having kind of goals that you're working towards that create meaning, if you will, along the way, and sticking with some of those patterns over a period of time. So having said that, there's a lot of things that I'd like to cover today that we just didn't have time to go through, but I feel like we need to probably move on to the next aspect of the talk, which Lindsay's going to do.
All right, thanks, Dr. Stoll. So we will move into some of the system level strategies, but remembering that a lot of those things can carry over as well. So there's a lot of research being done, not only looking at the drivers and contributors to burnout, but in which we've talked about in the past, like he mentioned, but then what can organizations do to then effectively mitigate this or help to relieve this among their employees? And so there's a lot of specific strategies that organizations can try, but that can become overwhelming to select from these, especially if you don't know what factors to prioritize. So without assessing the needs of healthcare workers within the organization, sometimes even at that individual department level, this can lead to fragmented approaches or some surface level strategies that sometimes people hear about, the one-time trainings or pizza parties or yoga classes. So the first step is really to choosing which strategies will be most effective is accurately identifying what the needs are. So starting with an assessment. It's also no surprise that to have a comprehensive plan to address wellness in healthcare, you have to have the involvement of leadership, which we'll talk about some processes to do these. And then finally, I'll just end with a few strategies that have been shown to be effective within the healthcare setting environment. So I'm going to spend a little time on this figure here, and this comes from a journal article that was discussing a health professional wellness hierarchy that's been adapted from Maslow's traditional hierarchy, which I'm sure most of you are familiar with, at least in some part. But this talks about the adapted one and how it can be used to design and prioritize interventions at that system level. So Maslow had stated that humans are motivated by unsatisfied needs. And so as needs at any given level are sufficiently satisfied, we then strive toward the needs at that next level. And so this health professional wellness hierarchy assumes that rather than being motivated by unmet needs, health professionals are motivated by their desire to deliver excellent care for their patients, while at a minimum, not paying an overwhelming personal price, but optimally feeling connected, experiencing joy during their practice, and really contributing to their fullest ability for their patients in the field. So as we look at this, for example, it's going to be hard to benefit from a resilience course or meditation if at that basic level you're dehydrated, depressed, or scared for physical safety. So we'll just walk through each of these real quick on this screen. So as we start with level 1, which are the basics, the physical and mental health. So what may seem basic is actually often overlooked. So Dr. Stoll talked about this, the importance of exercise, diet. So from a physical health perspective, do healthcare professionals have access to hydration, to food, to sleep? Are they having enough time to even use the restroom? Are breastfeeding mothers having time to go do that? And so even though we understand the link between caloric intake and cognition are apparent, a lot of physicians and healthcare workers, they're often skipping meals or they're eating unhealthy or quick foods. One study that we looked at found that healthcare workers are often starting and ending their shifts dehydrated, which can also lead to poor cognitive functioning and decreased mood. So when we think about the basics of mental health, then are there mental health resources not just available, but are they promoted? Physicians have been shown to suffer higher rates of depression than other professions and have a higher rate of suicides than the general public. So it's really important to assess mental health as staff, but also their willingness to use the resources that are available to them. I know within our program, we're constantly fighting the stigma behind that. And other healthcare systems have tried to make this easier if and when they can embed mental health professionals on units for both patients and staff. When you look at the next level for safety, Maslow had stated that after the urgency of meeting those physiological needs are met, our desires are then for our safety and protection, and those become the high motivators. So that's looking at our routine, our predictability, and obviously in healthcare, those two things are really hard to come by, especially when you look at the different specialty types. However, what we're seeing is episodes of serious workplace violence are 4 times more likely to occur in healthcare settings than they are in private industry. And so that can be even more so when you're looking at emergency or psychiatric care. And so having adequate security, especially in high-risk areas or outside of normal business hours, is really important to meet that level. There's also threats to personal safety from time pressures or inadequate staffing. Healthcare workers are more likely to be injured in environments where there is poor staffing, where there's poor communication, or overall lack of attention to safety. And then the final one here is job security. It also arises as a threat to wellness. So with many hospitals closing, especially in rural areas, jobs are being downsized, and that can affect someone's feelings of security or affecting their own mental health. Then we look at that third level for respect, compared to Maslow's traditional hierarchy, where that shows third levels belonging. In healthcare, it really is focused on respect. And so this includes respect from coworkers, supervisors, patients, also respect for personal time from leadership. And so one example that this study had given was talking about lack of appropriate needs to be successful. So there was a surgeon that had been notified of his productivity was low. And so in an attempt to address this, he had requested that the operating rooms be turned over faster. He had no response from administration regarding what changes could be made or what aspects of that, but then later received another notice of low productivity threatening pay reductions. And so it's really difficult to be effective if your environment is not set up for success. And we see that same concept when we think of diet and physical activity and how much our environments play a big role in the success of that. Another level of respect is among colleagues. So disrespectful or disruptive behaviors from really anyone in the healthcare team can cause reductions in the quality and effectiveness of healthcare. And even more so when leadership isn't addressing these behaviors and if there's no policy in place to deal with that. And then there's also been growing research about how patient disrespect is contributing to healthcare worker burnout. And then we also think about respect for personal time, which the EHR is always something that comes up, the charting requirements. It's also been noted different technological issues within the system. So what are those things that are contributing, parking lot gates not opening, you're late to your shift, you're starting a day off bad, early log out times on devices, you're constantly having to re-log into those. People have reported different dead zones of Wi-Fi within their hospital. So these small technological contributors that can contribute to burnout too. And then when we look at that level 4 appreciation, healthcare workers often resist the desire to receive thanks or gratitude. But in reality, they want this and they need this to be appreciated just as much as other professionals. And they want to feel interconnected to their work and other individuals at work. And compensation goes hand in hand with that appreciation too. And then in Maslow's final tier of his traditional hierarchy, he discusses self-actualization and the notion that even if all these other needs are met and you're at this top level, somebody may still feel discontent if that person is not doing something that they are passionate about. And in healthcare, for physicians, for APPs, nurses, this is really healing the patients and improving their lives. And so as medicine has become so much more than just caring for the patient, but all of the bureaucratic tasks that go along with it, they can slip further and further away from that. And so this really requires the authority at their level, the resources, and that autonomy to both practice medicine or, in the instance of academic medicine, contribute to their research and advancement of that. And so as we look at this all together, institutions should really systematically assess the needs to begin to identify what strategies are going to be most effective. And this starts with just speaking to the individuals that it actually impacts: physicians, APPs, nurses, also CNAs, environmental workers, volunteers, support staff, and really intervening at that lowest level first and then moving your way up. So like we mentioned at the beginning, this may look and feel different even from one department to next within the same hospital or healthcare system. So then once you've assessed all the needs, you begin identifying some of those strategies to help improve some of those things that have come about in your assessment. And so this is where we encourage partnering with leadership to make sure that this is as effective and sustainable as possible. So this slide just shows the typical dimensions that we often look at within a system that can lead to burnout, and typically what behaviors you might see if work conditions are less optimal or more optimal. And so ultimately, you want to create as optimal of an environment for both the patients and employees within a healthcare system. But that's not to say either that healthcare executives and leadership aren't facing their own challenges too. They're fighting increasing price competition, narrowing insurance networks, greater proportion of patients with non-commercial insurance, declining reimbursements, mergers, healthcare worker shortages, cyber attacks on information security. So as we think about all these and we think about how have these been addressed in the past, and what we typically see is increasing productivity expectations for physicians, but all the time with the same amount of time or the same resources. They try to implement efforts to improve their efficiency, but a lot of times it's without consideration from the medical staff that's delivering that care. And then we often see expense reductions to decrease cost of care, so doing more with less. But because they're so faced a lot of times with these numerous potential threats, the healthcare executives often focus on what are those external threats. And what this does is can create a blind spot for what's internally threatening the organization health. And those executives need committed and invested productive physicians to help the organization improve quality and mitigate internal threats. But on the flip side of that, as Dr. Stoll mentioned at the beginning, we're seeing over 50% of physicians reporting symptoms of burnout nationally. So this poses a problem, and it also creates the need for that teamwork too. So we won't talk a lot about how burnout is tied to patient care. We've talked about that before. We know the risks. So what can be done about it? And there's been some extensive evidence that shows organization and practice environments play a critical role. And so when we look at this, reducing burnout or promoting engagement, whichever way you want to look at it, it's a shared responsibility between the physicians and the healthcare organization. So we talked about some of those individual strategies, but a lot of this is going to fall on the healthcare organization to create that culture and deliver a system in which they can do that. So this figure actually comes from the another article, it looked at one medical center and what they were doing. And this was through the Mayo Clinic in Rochester, Minnesota. And they have placed an incredible emphasis on healthcare well-being for their staff. But they kind of go through these steps as they're looking, and we'll just go through these quick. So we talked a lot about assessing the problem before and having that direct interaction with the CEO and the physicians within multiple formats to discuss those challenges. It really creates that level of trust that the problem is recognized at that highest level and that individuals are willing to work on it. And then when we look at harnessing the power of leadership, so really investing in leadership skill building for physician and other medical staff team leads, they have a direct impact on so many other of the healthcare workers within that system, that ensuring that they're properly equipped with the right training, and having leaders who understand that individual motivation within those team members can really create that investment, which decreases risk for burnout as well. And then when we look at develop and implement targeted intervention, so the specific way in which drivers of burnout among healthcare professionals manifest, it really depends on the specialty and the work unit. So for example, inefficiency in the practice environment, it's broadly applicable across healthcare, but it'll take individual attention to each unit to identify what is it that is inefficient. Is it clerical? Is it something with the EHR? Is it the rooming procedure? Is it the relationships within the team? And so this is where the process listed can assist with that. So what the Mayo Clinic did here is they started by assembling a team for the healthcare system. And this would include physicians, administrators, anybody with that expertise in leadership or in organizational efficiency. And then this team would meet individually with the different departments and their unit leaders. And this was really to gain insights on what was their perspective of what those local challenges looked like. That team would then conduct focus groups with the individual employees on that unit and discuss the different drivers of burnout. They'd identify or acknowledge those macro factors. So when we think of that, those are those larger scale inefficiencies that are really going to be harder to address or need a larger initiative. So for example, they could say, yeah, we're short-staffed 10 nurses, but we know with that workforce shortage, that's just not feasible to implement at this time. But what they also did while listening to those is they'd also identify some of those smaller or those local inefficiencies and talk through what are some of those realistic solutions. So we talk through some examples, but to talk about the EHR charting, is that something within that, the login times, is there extra clicks? Is that something that we could discuss and could be changed by IT? So then that initial team goes back to the unit leader. They share those challenges that they discussed with the employees. And then that team really challenges that unit leader to work through implementation of what some of these fixes could look like. That team also provided coaching and consultation to that unit leader. And then ultimately, that unit leader has some accountability from the team to help them implement it, but they also have a better idea from staff what those issues are. And so from there, they just continue to monitor and assess those changes and continue to work and move on to some of those other things that were identified. So finishing out here, cultivating community at work, there are unique challenges in healthcare as a physician. We know medical errors, malpractice, and peer support has always been critical in navigating those professional challenges. Historically, that happened through time spent together in physician lounges, but we know that with increasing productivity expectations, that's just happening less and less, if at all. And so organizations can really look at what do those communal spaces look like. The Mayo Clinic actually implemented 1 hour every other week of protected time that physicians met with small groups of colleagues related to different experiences that they were facing at the hospital. And really allocating that time for that peer connection can really help to cultivate that community. When we look at rewards and incentives, a lot of healthcare organizations link compensation to productivity. Some of these are based solely on productivity. Others might have a base pay with the possibility of bonuses. And while a lot of people are motivated by money, it's important to understand that when can that actually contribute to burnout? So if a physician's trying to see more patients, they may shorten time spent with a patient, order more tests or procedures, or they work longer. And those first two, shortening the time with the patient and the ordering more tests, affects the quality of care, and that latter, working longer, is actually going to contribute to burnout. And so this brings about the incentive to overwork, which we know can lead to burnout as well. Other incentives that different healthcare systems have implemented looks at greater work flexibility, that protected time for different meaningful aspects of work. So Dr. Stoll talked a lot about finding that meaning in what you're doing. And so that might look different for different physicians or different APPs or nurses. Is that community outreach? Is it research? Is it providing mentorship? And so there's really no right or wrong model, but it's just important to know what those risks are for each of the rewards and incentives. Dr. Stoll also talked a lot about the values within work. Healthcare systems all have a strong mission statement, and they're related to patient care. And the medical staff are generally fully behind that, and they honor that. But sometimes if there's that internal erosion to that culture, there's not that reciprocal feeling that the staff is cared for as well or taken into consideration. That flexibility and work-life integration. So are there opportunities for working less than full-time? Is there flexibility in shifts, earlier or later start times? And then looking at resources and resilience, we've talked a lot about resources for that, but having a really wide array of them. It's not a one-size-fits-all. And really being dedicated and intentional to truly make that impact too, that facilitating and funding that organizational science, which is really what a lot of this healthcare wellness has focused on. So after researchers identified the need to work hand in hand with their leadership, there's also been a lot of work here, provided examples of strategies that have been found to be effective across different healthcare systems, and they generally fall within all of these categories. Just given time, I'm going to go real quick through these. We will share out these slides with you. But when we look at safety net resources, so are there campaigns to reduce stigma, normalizing the use of those resources that might already be available, providing peer support programs, clear guidelines for professionalism and a process for which unprofessional behaviors are addressed, providing financial planning resources for your staff, professional coaching for those dealing with challenging personal or professional issues. And I added our LifeBridge program here as just an example for what the Nebraska Medical Association had created for physicians across the state. When we look at resources to address specific needs, like I mentioned, the one size fits all, it doesn't. And so are we being mindful of new hires and that they have everything they need for onboarding or transitions? When we're looking at early career, do they have, are they effectively managing their time? Do they know how to do that? Do they maybe have a mentor in that role? Looking at late career physicians, are they ready for retirement? Do they have adequate financial planning in place? Are they ready for that identity shift that often comes with physicians retiring from practice? And then also making sure that you have appropriate parental leave policies. And so there's a lot of different resources out there looking at what different healthcare systems have modeled their policies after as well. Self-care and wellness promotional offerings. So we mentioned the ownership of burnout and prevention and wellness promotion as a shared responsibility between the providers and the systems that they work for. And so how is that system helping the clinicians stay well? What kind of resources for physical, social, emotional support are there? We talked before about that leadership development. So those programs to promote inclusive leadership, are there training opportunities available? Some of these deliberate approaches, again, to build up that collegiality and that culture that you want to build at work with the staff. A couple of these things I wanted to touch on. So these commensality groups are really structured discussion. And these are those we've talked about different examples of protected time, but this is protected time for those teams where there might be a facilitated discussion about building that team connectedness and engagement, things that they're dealing with. That can be virtual, but we all live in a virtual world now. So some of those are encouraged, meet over a meal or with coffee. Those social events, these Swartz rounds. So this started under the Swartz Center for Compassionate Healthcare. And so this is a structured outlet for expressing difficulties and frustrations of working in healthcare today. And so they have a website with more information, and they offer resources for how to start implementing those within your system as well. We talked about those communal spaces already. Again, those programs to mitigate incivility. So are those inappropriate behaviors being addressed? When we look at assessment of well-being and its drivers, continuously assessing. So you do that assessment and you find these things, but it's ever evolving. Are you checking in? Are you sharing those results out at that organization level or that work unit level? And using that data to engage teams in conversation about what are our greatest opportunities for improvement. And then the system-wide approaches that really enable physicians to look at day-to-day focus or things to focus on. So the AMA has a lot of toolkits that they provide, and I just listed a couple here. The List, Sort, Empower one, it's a toolkit which describes how they really focus on the systems and behaviors and not individual people as a source of some of those practice issues. And then you've probably heard of that gross model, or getting rid of stupid stuff. And it's another AMA toolkit. And this is really working through common practices during the workday and identifying or eliminating any of those unnecessary steps that to optimize time in your day. And so a few resources that I just wanted to tack here on the end. So we talked a lot about what some of these system interventions look like. The AMA Steps Forward has a great accumulation of resources on theirs. Lots of toolkits that you can use practically within your work. I talked a lot about the Mayo Clinic today and the work that they're doing surrounding physician and healthcare wellness. And they continuously post their publications on their work that they're doing in this area. They also developed the Wellbeing Index, which is their assessment tool that can be used in different hospital and healthcare systems. And then finally, the LifeBridge Nebraska program, which offers educations like what we did today, our presentation, but also that peer physician coaching for any Nebraska physician or resident in the state. So again, we'll share these out for you so you have the resources of the books and the websites that we used. But I just wanted to open it up if there are any questions